Whoa.
All right, thank you everybody that is logging in tonight. My name is Dr. Catherine Espana. I do ask everybody that comes in to please mute yourself to make sure that it doesn't disturb the presentation. You can definitely unmute yourself later if you have any questions. For those of you that don't know me, I am a pediatrician in Houston, Texas, who is completely floored and excited about this technology. I've been using it for 7 months now. I'm using my husband, who's an OB-GYN, and I can tell you that the results we are seeing are crazy. And the results that I'm seeing with my patients and my friends are just kind of off the charts. So you'll hear about a little bit about that later. But first, I want my friend Monica to talk really quickly about, her results, what she's been going through, and then she's going to tell us a little bit about the company.
Good night, everybody. How's everybody doing? Well, the big question, well, like Dr. Espana said, my name is Monica Suarez. I'm a mom, I'm a wife. And the big question tonight is, have you been patched yet? So I've been using the patch for the past 10 weeks. And let me tell you, I've been one of the lucky ones that I started feeling results on the third day. Everybody's different. Some people feel it on the first day, first week, first month. So it depends on everybody, and it's okay. On the third day, I started feeling more energy. I usually used to drink three cups of coffee, but now I'm just the one in the morning, my favorite coffee. I felt more resistance when riding bikes with my kids, sleeping better. And as a mom, you know that it's super important to sleep well. And well, for me, the most important has been my dad. When I heard about the patches, I was thinking mostly about him. Obviously, I want it for me, but thank God I don't have anything big, any big problems. But my dad does. He's 84. He has diabetes for the past 30 something years. He has heart problems, you name it. And he started using the patch at the same time than me. And the first day that we started using the patch, we were talking to his doctor, his diabetes doctor. We read all his numbers for his sugar, and the numbers were all over the place. So the doctor didn't change anything. Insulin was the same, medications were the same. And he said, let's see you in 2 weeks. So we started doing a every 2 weeks meeting with his doctor. The second week, so this was the second week of us using the patch, and my dad read his sugar numbers for the past 2 weeks. And the doctor said, your numbers are amazing. I want you to try not using the insulin. And for my dad, he was scared, because he's been using insulin for the past 30 years. So it was a big shock for him. I was excited because I knew it was a patch. And now it's been 10 weeks that we've been using the patch. So it's been 10 weeks and 8 weeks for him without insulin, which is huge. He went back to the doctor a couple of weeks ago. He read other tests that he did for blood tests for the blood sugar. And when he did it in May, the first time, his numbers were number 10. That it's a big number for that test. The test is A1C. And then when he did 3 weeks ago, after using the patch for 2 months, the number was 8.1, which the doctor said that it was a great number. And he told him, whatever you're doing, keep doing it because it's working for the past 2 months. And then I told the doctor, it's the patch. And he said, yeah, I believe it's the patch. But one new thing that I have, Dr. Catherine, that I didn't tell you. So we were talking the other day with my dad, and he always writes notes for his cardiologist, right? He has meetings with him, appointments with him every, 3 months or so. So he was he always writes anything that's hurting, any problems that he has. And he was putting it to a new paper to, look nice and clean so he can show him. And he said that more than half of the problems that he was having are gone, including how his legs used to bloat, because both of them were always like really big, right? And it was because of the circulation of his legs, right? In his legs. So I need to get that list. He told me he was going to get me both lists, the old list and the new list. So, it's my dad. He's 84. I see him with more energy. I see his hands. He doesn't have, the arthritis in his hand is doing better. So it's just amazing to see all the amazing miracles that this patch is doing with my family and so
Hace
many
un
people that
tiempo,
I know.
papito. No
And
sé.
all right, so yeah, you can switch to the slide, please.
Yeah, so really quick, since you talked about your dad and the circulation, I just wanted to share something that came to me really quick before we get going is my husband's best friend's mom, who is also about 80, had really bad neuropathy. She said she couldn't sleep because her legs were burning and they were hurting, and her legs were actually like really dark color. because not getting enough, oxygen and circulation to her legs. And within a month and a half of wearing the patch, she sent me a video. It was hilarious. She was so happy. She said, I am sleeping, my legs don't hurt. And the circulation problem she showed me, she goes, it's changing the color of the
Yeah.
skin, even changing the color. So she was really funny. She goes, I don't know who invented this patch, but he deserves an Oscar. So she said an Oscar, and I'm like, oh my goodness. So anyway, so I had to share that because it goes right along with what you just said. It's pretty amazing. So
It is amazing. And yeah, his legs the same. They were really dark and they're not as dark as they were. So it's really amazing. Okay. So LiveWave has been here for 20 years. This month, in October, actually, we're going to turn 20 years. So it's been here for a long time. And we went from 20 million in 2021 to now this year, we're going to be making 600 million. So the company is growing crazy. And we're open in over 75 countries. So that means that in any of these countries that you know anyone, you can help them get better health, which is great. It's not another Me Too product. So we are unique in the market. There's nothing like this patch. And, there's a lot of companies with supplements, you name it, but there's no one that offers what we can offer. Next slide, please. And yes, LiveWire is now ranked #1 momentum company or businessforhome.org, which is big right now. We are really growing. We're helping so many people worldwide. And next slide, please. Okay, so let me tell you now about David Schmidt, our inventor, the genius. He is the one that invented our star patch x39. But his dream since he was little was to be an inventor. And over 20 years ago, the government contracted him to invent something to give energy to the Navy SEALs, something especially for the submarines. And that's when he came up with the first patch. And that patch did that, gave them energy, no drugs, no chemicals. So it was amazing. But then September 11 came, and the government obviously focused more on weapons. So that's when David Schmidt went out of the market, and he was talking to athletes, other inventors, doctors. And that's when, I don't know if you guys remember, in 2004, for the Olympics, the swim team for the Stanford University, they were breaking their records, they were winning, and they were wearing a patch. So there was this big controversy of what those patches had, what was it on them. So they had to send them out for testing, and obviously they came out like they were natural, they didn't have any drugs, nothing. But that's when his name came out, and more athletes knew about him. He started specializing in age reversal. And later on in 2008, he focused his attention on stem cell research. And his recent patent for the X39 took 10 years and 4.5 millions to bring it out in the market. Next slide, please. And yes, so we have over 150 patents, and this is one of the patents that we have in the X39. And for you guys to know, for a product to be patented, it has to have two things. It has to be unique. It has to be the only one in the market, and it has to do what it says it does. So that's what this patent says. It says embodiments. Oh, if you can go back. Embodiments as a result of elevating copper peptide includes activating of stem cells, improvements in energy, elevation, and antioxidants. And now Dr. Stein is going to tell us about the science behind the patch.
yes, thank you, Monica. Yeah, to me, what impressed me, first of all, is obviously the technology, right? So as a physician, if I have something that I can give people a better quality of life, as that's what it is. This is not going to cure diabetes per se, as she was talking about how her dad was able to get off of insulin, but he still has diabetes and he still has to deal with that. Eventually, in years and years, who knows, it maybe, the body is able to kind of heal and help a lot. But this is giving people a better quality of life, because if you can take less medications, less chemicals, and you can move better, things like with less inflammation, you don't have to just live with it. There's so many people out there that unfortunately physicians say, we can't do anything for you. I think you're just going to have to learn how to live with that hip pain or that knee pain or whatever else it is. So that is the first thing that, of course, I loved about this. And then the second thing was the company and the business, like Monica was saying. It's a company that has been around for a long time. So it's not something that was invented yesterday. It's a company that's in over 75 countries. And so essentially, it's been successful not only in the United States. To me, that spoke a lot, especially because the Asian countries were the countries that I feel like knows a lot more about alternative medicine, and they're really hard to convince. If something doesn't work, they're not going to use it. So this is how this patch works. Essentially, it is
Hola.
a stem cell activation patch that the faster you age, when you have less stem cells, sorry, you age faster and the slower you heal. For example, all of our kiddos, those of you that have kids, they have lots of stem cells. They have lots of copper peptide in their body. And so if for some reason they get hurt, for example, I always use the example of if you break your arm, I put a cast on them as a pediatrician. The cast is not healing that fracture. It is actually their own body that it's able to regenerate and to heal whatever is going on in their body. So their own body and their own stem cells, their own copper peptide tells the stem cells to go in and heal that fracture. If I break the same arm at the age of 46, unfortunately, I don't have that capability. After the age of 25, only about half of your stem cells are active. And after the age of 60, you lose almost all stem cell activity. Only about 90% of it is working, which is why, the older you get, the more that you start feeling the tiredness, the not sleeping, the achiness, the hurting, the inflammation, all of those things come because our cells are just getting older. So what if you had something that could keep your cells looking younger? So how does the X39 work? It's a proprietary form of phototherapy, meaning that, like Monica said, we have a patent for it. Nobody has anything like this. It's a little round circle. I'm going to show you the one that I have here. So it's a little round circle like this. It's literally like a sticker. It comes in, we call it a sleeve, but a little envelope that has 30 of them in it. So each envelope is a 1 month supply. All it has, that little white circle in the middle, it is a patent nanocrystal technology. So they are organic amino acids that are in there that create a little lattice. That lattice acts as a reflective, kind of like a mirror. Okay. It is non-transdermal, meaning that nothing is going into your skin. There's no medicine, no chemicals, nothing is going in there. It's non-invasive. So the way it works is we as human beings are really all mammals because other mammals like cats, dogs, horses also have this capability. We emit energy, and that energy actually is in the form of infrared light. So if you can't see this infrared light to the naked eye, but if you were to put night goggles on, you can see when it's really dark, little like red shadows moving around. And so that infrared light activates that little nanocrystals that are in the middle that act kind of like a mirror. So that light bounces back off, and for a lack of a better word, it gets injected back into our own organism. So phototherapy, most people hear about the sun. Everybody knows or accepts it. You might not know how it really works. I mean, there's a lot of things in the world that I don't know. I don't know how my car works. I just know that I turn it on and it works. Same thing with, I think, the sun. Most people accept that if you go out in the sun, you know that your body makes vitamin D. You might not understand exactly how it happens. There is a, biochemical reaction, but the frequency of the sun tells your body, gives your body instructions to make vitamin D. So the frequency of this patch, this energy that gets reflected back into you, tells your body, it gives your body instructions to create this copper peptide. It's called CHK copper peptide. It's a peptide that when we're really young, we have a lot of, and we know that that peptide helps with inflammation, with cell regeneration, and with activation of stem cells. So as we age, we have less and less of copper peptide, therefore less and less of the stem cells. So this is giving your body that energy, that extra to work as it used to work whenever we were younger. So what are the benefits of it? Usually these are the immediate benefits. Most people start noticing increased strength, reduce inflammation, meaning like anything aches and pains that you might have. You might notice, wow, my knee doesn't hurt anymore as it did, which is what happened to me. Definitely increases stamina. People are able to work out longer, stay up, longer doing certain things. My husband, for example, who's an OB-GYN, said he was doing long surgeries where he was standing up and he used to get really tired, and he's not getting tired anymore. It increases energy like you wouldn't believe. Like I wake up and I'm just ready to go. The mental clarity, I mean, this premenopausal time of mine at 46, I would go into a room and I'd be like, why am I here? What was I supposed to do? And I know a lot of you women specifically that are going through this can probably relate. I feel like I'm able to get so much more done during the day. It also helps to restore muscle and skeletal conditions just because it gives more energy to your muscles. Definitely improves sleep. Like I was telling you guys, I never had issues sleeping, or I didn't think I did, but I wasn't getting that deep sleep. I am now dreaming almost every night because I know that I am actually in REM, which is really deep sleep. So I wake up super refreshed to the point where I don't need any coffee or anything else anymore. And eventually it does improve skin appearance because it does improve collagen production all around as well. So what are the long-term results after a while? Well, for the first few days, the studies have shown that about 4,000 genes begin to reset in your body, which then get to work. Those genes get to work to try to fix whatever it is that it's broken. Everybody's different. Every organism is different. And everybody will feel things at different rates. I do want to point out that this is not a miracle patch. You cannot say, oh, in 3 days, in 2 days, I'm going to feel amazing like I did. I mean, I've been abusing this body, I keep telling people, for about 46 years. First, I was a professional dancer. Then, all of the stress that we live in every day, plus all the inflammatory foods we put in. There's a lot of things that go on to eventually kind of degrading our body. And so it takes a while for our body to get back to where we want it. But within 6 weeks, there's been studies that show that your brain becomes more balanced, meaning that a lot of the inflammation goes away and you're able to have that mental clarity. I've seen things with kids that are neurodiverse, kids that are on the spectrum, that it actually helps their brain to become balanced and they're doing things that they weren't doing before. I've also seen kids with hyperactivity and attention issues happen the same thing, just like I've seen older individuals that are dealing with dementia, where it's also helping them a lot. And then, like I said, within 3 months, some of the studies have shown that your collagen can increase not only on your outside, because we all want to look amazing, but our inside is also all made of collagen. So that's even more important because if we don't have health and our organs aren't functioning correctly, then it really doesn't matter what we look on the outside, right? And then what's really even more impressive to me, and it's funny that you said that your dad, Monica, has been talking to his cardiologist, is that a lot of studies have said that within 6 months of wearing the patch, they have shown that the hearts start reversing in age. People that have had issues with, heart problems, that they actually have studies like an ejection fraction, for example, that tells you like what percentage your heart might be working at. They are able to see that your heart is working better than it was before you started wearing the patch. So like Monica said earlier, this is not anti-aging, this is age reversing. The idea is that we're trying to revert ourselves to where they were a few years ago, which I know sounds like science fiction. Trust me, I was extremely skeptical at first, but after 7 months, and I think over 100 people that I personally know that have tried this, it's really hard not to believe. So I just, invite everybody to at least try it because that's what you need. The science is there. If you have any questions, ask the person that, that invited you here to send you our website with all of the studies and more. You can read about it until, you go crazy. I did. I read about it night and day for about 2 weeks before I really kind of started, grasping, just because that's what I wanted to do. But the best thing is to try it yourself and see how you feel and try it on your, on your significant others and your people you love, like Monica said, her dad, her mom. And then that way you can really kind of tell what's going on with you and your family. So how are you going to wear this when you decide to try this? Well, you're going to wear the patch 12 hours on, 12 hours off. The phototherapy causes, activation of cells. Your body also needs to relax and regenerate. So the x39, you wear it during the day because it will give you more energy. So if you wear it at night, there's a good possibility you might not be able to sleep well. You put it on either behind your neck or underneath your belly button because those were the acupressure points similar to acupuncture, and those were the points that they did all the clinical studies. When you do a clinical study, everybody has to do exactly the same thing to be able to prove that it wasn't by chance that it worked, right? Everyone did the same thing. And so if it worked for everyone, then it must work. But however, anecdotally, people have said that if you have, for example, shoulder pain, I had a patient who had a rotator cuff tear. I told him to put it on his shoulder because it really kind of concentrates there. And within, about a month and a half, he couldn't move his arm past this. And then he came in, he goes, look, doctor, like I'm able to turn it around, move it. It doesn't hurt at all. So it really was working. So you might want to put it on if you have a specific issue where you do. But the idea is you put it on in the morning, you take it off at night, you throw it away, and you put in a new one. Rinse and repeat. That's why I said this little envelope here has 30 patches. So he has 1 month supply, essentially. Very important to drink a lot of water, okay? This also has a little bit of a detox property to it, so you can feel like you're dehydrated, plus your body just works better. Your cells don't work really good if they're not well hydrated. So I always have my cup of water here. I am drinking water constantly. The best way to stay hydrated is to drink little sips throughout the day, not necessarily to drink a whole 32 ounces in one gulp, because if you do that, it's just going right through you and your cells are not really absorbing what they need to absorb. So X39 is so sophisticated because, I mean, it's just hard to believe, okay? It really is kind of like science fiction. Yes, it's very simple to explain because of all the testimonies that we have seen, plus it's really easy to use. You don't have to think of things that you're ingesting, taking 1,000 little supplements. You literally just peel it away like a sticker, you put it on, and you go about your day. And the most important thing is that it works. So people ask, how do you get it? I mean, there's 3 different ways that you can. Like I said, I recommend to do a 3-month supply because that's kind of like a treatment to let your body really kind of heal and work on everything. Some people, if they want to share with their significant other or other family members, can buy a gold pack. You get 5 of them. Or some people want to share with everybody and they might have a big family, and absolutely, then the diamond might be a better option for you. And so just talk to whoever asked you to come on today. Ask them any other questions that you have. I do want to invite anybody that's on that maybe has tried it, if they want to share, a couple of minutes of maybe what they have felt so people can hear from someone else, that would be great. Anyone that's on, I know everybody has their camera turned off, so I feel like I'm talking to a blank screen, but I know a lot of times we're doing different things too.
Catherine, I can tell you a couple of things that's happened in my family.
Thanks,
Um,
Dana. What's up?
well, my husband's had one hip replacement and he really needs to have his other hip replaced, but he's been wearing the patch now for about 10 weeks and he puts that patch right on his hip, and within just a couple of weeks he noticed a big change in how his pain level was, and he's not having near the discomfort that he used to have. He can get in and out of his truck good, and he's playing he's playing golf. Just he's playing out of his mind. So we've all had a lot more energy. My dad's neuropathy is much better. My sister, we just got back from Dollywood today, and we were going down the road, and she was reading something to me, and she said, "Do you realize I don't have on my reading glasses?" And she and I both have what they call 20 fingers vision, which means you probably know what it means, which means you can't see beyond your fingers without your contacts or glasses. And she had her contacts in, but normally has to wear reading glasses, but she hasn't had to wear those. So we've just seen so many improvements. Um, I mean, I could go on, but it's truly an amazing product.
Thank you, Dana. And I am still waiting for that vision change. You're not the first one that I've heard it from. I've heard from several people stating that their vision is changing and they've had to get a different prescription or anything like that. I have not experienced that yet, but like I said, everybody's different and your body's smart and needs to know where it needs to go to fix things. And maybe that's not a priority to say for me. But I have heard that from other people too. So thanks for sharing. So it is almost right at 7:30. And so I once again want to say thank you so much for logging on. This is meant to be a short to the point informational meeting. Any other questions that you have, please reach out to the person that invited you here. I feel like it is an obligation to share this. I am sharing this with all my patients, so is my husband, because if you can try to avoid that many medicines and you can try to make your body work better without having to take so many drugs, then I mean, that is amazing. I am not anti-drugs. I'm definitely not anti-vaccine. I am a pediatrician. I feel like there's a place for certain things. But I also know that many medications have a lot of side effects that it might fix one thing, but then it messes up with a whole lot of different things. So this essentially has no side effects. Anyone can use it. I do want to end with this. There's a caveat to when I say anybody can use it. The two people that we don't recommend it with are three. Number one is pregnant individuals. I think that it's a miracle that there is a normal baby that comes out with so many things that can go off genetically. As a doctor that you know so much, to me, it's a miracle that most babies are born perfect. We don't want to just mess with anything. I don't think anything would happen, but it's just best whenever you're pregnant to be as conservative as possible. So I don't recommend this for pregnancy. I don't recommend this with anybody that's had a organ transplant, because when you have an organ transplant, you're taking immunosuppressive drugs, means you're taking a medicine to decrease your immune system so it does not mess up or reject that organ transplant. This tends to increase your immune system. And so, God forbid, if you increase your immune system and then you have issues with your organ transplant, we don't want that either. So we'd rather stay away from that. And if you have cancer and you're actively going through chemotherapy, it is probably best not to do it while you're doing chemotherapy because so much is going on. But a lot of people use it in between treatments or before or right after it. So that really is the only people that I would say that might be contraindicated. Other than that, there's no side effects and anyone can try. So once again, thank you so much. I hope you guys have an amazing rest of the evening. And if you have any questions, I'm here. Let me know.